Columbia, a special report. The COVID-19 vaccine in South Carolina.
Good evening, everyone. Thank you for joining us this evening. I'm Judy Gatson. Welcome to our WIS News 10 COVID-19 vaccine special. It's hard to believe, but it has nearly been a year now since the pandemic hit South Carolina. We know that the uncertainty, the financial impact, the emotional impact of the changes in our day-to-day lives, the celebrations that we have missed, it has taken a great toll on all of us. So over the next hour, we are committed to answering your questions, calming your fears, and giving you the expectation, the plan for what is ahead here in South Carolina. Joining me tonight, my co-anchors, Sam Blyweiss and Alicia Barnes. We will also have reports from Emily Wakeman and Adam Mincer on everything really from the critical vaccine rollout to the situations at hospitals around our state. Much more still to come on that front. First, South Carolina is still in phase 1 of the vaccine rollout, which is really kind of the jumpstart point, right? Where we started the vaccine rollout for public distribution. Let's take a look at who's qualified. Initially, at first, phase 1 included frontline healthcare workers and long-term care residents and staff. Recently, though, it was expanded to include hospital patients who are 65 and older. They were added to phase 1 along with everyone who is aged 70 and older, and that had a big impact on vaccine administration. More on that to come. We want to update you on the latest COVID-19 numbers in our state. Now, DHEC is still working to resolve an internal issue, so this is not the full reporting. They expect to have it resolved soon, but these are the latest numbers. The agency is reporting over 4,800 new coronavirus cases and 18 deaths in our state. DHEC says our percent positive rate is currently 26.5%, with 18,115 individual test results across the state. That sets the table for our conversation with state epidemiologist Dr. Linda Bell. Dr. Bell, thank you so much for your time this evening. I say without reservation, you are in fact the most trusted voice in our state when it comes to fighting this pandemic. So let's start with a state of our state, so to speak, when it comes to fighting the pandemic. Earlier today, DHEC announced that we have moved from a containment to a mitigation phase in fighting this. I know that means specific things for your staff, but in very plain language, what do South Carolinians need to take away from this shift?
Thank you, Judy. Thank you for having me this evening. Maybe it's just some quick definitions. What we mean when we talk about containment is that we attempt to contain the spread of disease from each and every individual. We do contact investigations and we interview them to identify their close contacts. When we move to mitigation phase, that's when we've reached the point where the sheer number of cases means that it's not really possible to investigate in detail each and every case. So what we do is we prioritize the investigation of cases who are most recently diagnosed. That means they are more likely to be in their highest infectious period. And then we also focus on investigating those who are more likely to spread, who are in congregate settings or in other settings where they're more likely to infect others. So we prioritize those so that we make sure that they have the information that they need, but we get assistance from them and ask them to notify their contacts. But the other most important thing about the mitigation phase is that this relies heavily on community level interventions. When we're in mitigation, we need entire communities to take steps to follow protective measures, to have widespread use of masks, physical distancing, so that the whole community is responsible for limiting the spread. Because there are so many cases, we can't investigate in detail each and every case as we do in our containment.
So obviously the situation is getting worse, not better in South Carolina right now. Dr. Bell, earlier this month, we set new records, daily case numbers topping 5,000, a positivity rate topping 34%. I think we're way past the point of real talk. I mean, you and other officials at DHEC have been begging people to follow the protocols. What do you have to say tonight, considering the shift in strategy, considering how difficult it is now to contain in our state? What do you say to those who still refuse to wear masks when around other people, who are still holding parties and gatherings and just ignoring the protocols?
Yes, and so a couple of things. I know that we're very optimistic about medical advances, the vaccines, we'll talk about them, new drug treatments, but we don't want people to lose sight of the fact that we have evidence-based interventions with the use of masks, the physical distancing, the good hygiene, that there's abundant evidence that those things are actually evidence-based measures to prevent the spread. I know people are tired. We've been doing this for many, many months, asking for compliance with these prevention recommendations. But as the disease levels go up, we want people to understand several things, that they have to believe the numbers. We are collecting this case information. We're counting the number of individuals who are infected, the number of individuals who have died. It's the leading cause of death now. Our hospitalization rates are increasing. Our bed utilization rate is increasing. So people have to believe those numbers. This is not a myth. This is a virus that is affecting nearly every one of us. So I don't know anyone who has not been touched in some way, who has either had the illness, who knows someone who's had the illness, who's lost a loved one. So careful attention to the impact that this virus is having on the entire community in a variety of ways is what I really want people to pay attention to. And then with some optimism, the fact that we can control this, that we don't need to just stand by and bear witness to what's happening, but if we take these measures at the community level, at a community mitigation level, and pull together and do this universally, we can actually make a significant impact from the community as a whole in making those disease rates go down. And I have said this before, that we see these effects in a matter of weeks. In a matter of about 4 weeks, if we practice these universal compliance with the recommended measures, we could, a month from now, be out from the very high rates that we're seeing. It's going to take us a while to get down from where we are now, but those are some of the things that I'd like people to consider. It's the impact on the overall community. And if each of us doesn't take some sort of social responsibility for ourselves, for the other members of the community, then it ultimately impacts all of us.
Dr. Bell, let me ask you just in a very straightforward way, considering where we are in South Carolina right now, the strain on our hospitals, are you asking anyone who's in the power to pass a mask mandate for their city, community, or even the state to consider that now?
Well, we've looked at evidence from other communities. There are published reports of the effectiveness of mask ordinances within communities. We've seen from one state to another. In fact, DHEC has released its own information. When we compare communities where mask ordinances are in place against those where mask ordinances are not in place, we can see the decline. We can see the effect of the use of masks. When compared to communities where those mask ordinances were not in place, the disease rates go up. So there's hard data to show that community-wide adoption of these measures works. And so at whatever level that can be done, whether it is at an individual business level, where they make sure employees follow the guidance, that their patrons follow the guidance, if it's done at the level of cities, that's an improvement. At the level of the county, that's a greater improvement. And to the extent that we could do something like that with widespread acceptance at the state level, we would all be in a much better position.
I want to let our viewers know that we are streaming live on the WIS Facebook page. We'll be taking some of their live questions coming up with Sam Bleiweiss. But before we get to that, I want Dr. Bell, if we can, to possibly reset expectations, because it's my estimation that when the governor made the announcement last week, adding those who are 70 and older to the phase 1 schedule, a lot of people thought, hey, I'm going to be able to call my hospital, my doctor, and be able to go get those shots right away. And what they're seeing are notices from hospitals. Newberry put out a notice today saying they just don't have the resources to offer vaccinations right now. Kershaw Health also put out a notice today saying that they're getting up to 200 doses per week, but that based on the overwhelming response they've already had, it's going to take them at least 10 weeks to take care of the people who have already signed up. But it leads to the overarching question of, were we really ready to add 70 plus to our vaccine distribution?
Well, we know that the vaccine supply is very limited. And we also know that we want to get as many people protected as possible, as quickly as possible. So including individuals in these various phases acknowledges their risk, either the risk of exposure, their occupational risk, or it recognizes their risk of being in a setting where they're at increased risk for exposure, or that they may be more likely to suffer adverse consequences. For example, those 70 and above, we know that they have a approximately 17 times higher risk of severe consequences than do younger individuals. So the data tells us that it makes sense to include these populations, to highlight the fact that they're at risk. Unfortunately, it doesn't change anything for the vaccine supply. We'll continue to receive the weekly allocations of doses that are not sufficient to cover all of those who we recognize are at risk, with our ultimate goal of preventing deaths, preventing illnesses, preserving the healthcare system, preventing hospitalizations. So the inclusion of additional people in these phases, I appreciate the question that we have to have some realistic expectations. We recognize the risk, but we recognize the limitations in the supply. And the fact that it may take us some additional weeks when we look at all of those included now in the phase 1A population, it's over 900,000 people. And when we get roughly 60,000 doses of the 2 vaccine products that are available now each week, that's what I hope will help people understand some realistic expectations if we're looking at nearly 900,000 people to cover. Of course, we won't reach all of those. It's reaching those who want to be vaccinated, and we want as many as possible to want the vaccine, but the vaccine supply is a limiting factor. And so we still have to prioritize those at highest risk first.
And while we're talking about expectations, I want to talk quickly about phase 1B, that group, because they were anxiously awaiting to start next. And as you mentioned, because of the risk, those who are 70 and older have been put in line in front of them. So what is the realistic expectation now about when those in phase 1B could start seeing their appointments?
Well, Judy, the projections are difficult because we can't really speak to the vaccine supply that we'll receive each week. We believe we'll get roughly the same amount, but those things could change, those factors beyond our control. We don't know about the vaccine acceptance. We do know that we're getting more and more efficient at vaccine utilization. So as we get more providers who are strategically located throughout the state to improve access, we'll get better and better at people being able to get appointments, to be able to get the vaccine. But the number of weeks that it takes us to get there when we have a number of unknowns, the projections are difficult, but we recognize it will take at least probably 6 to 8 weeks to move through that phase 1A. And so things could change. We hope that the vaccine supply will increase, and we hope that the utilization will increase. And we know that the number of providers, the number of partners, and the number of means that we're reaching people from mobile sites, additional clinics in rural areas, chain pharmacies and independent pharmacies. So all of those will help us get there more quickly.
We're getting a lot of viewer questions, as you might imagine. Lee Fletcher asked about his mom being homebound, saying that she is at high risk. She's eligible right now. She doesn't have the ability, though, to go to a provider. Is there any option for her right now? And if not, what will be the option at some point?
Well, at this time, for those individuals who are homebound, that presents a challenge. One of the reasons is because the vaccines are very temperature sensitive. So transporting the vaccine around in the community, we have to make sure that it's held under those strict temperature requirements to make sure that the vaccine maintains its potency. We can't afford to waste any vaccine. So at this time, for those who are homebound, we're hoping that they will have help. Family members, loved ones, friends, or someone that can help transport them, help them make appointments, and then get them to where they need to be. But in the future, we are looking at other options for access. Maybe I don't foresee in the near future with the with the temperature constraints with these vaccines being brought to individuals, but there may be more accessibility at sites that are closer, mobile sites and things like that. So we're looking at a number of options, the possibility of drive-through options that have been adopted in some areas. We're exploring any and all possibilities to assure access as best we can, as quickly as we can.
All right, we want to bring our Sam Blyweiss into the conversation. She's been on our Facebook Live answering the questions that she can, but also has a few questions to pose to you, Dr. Bell. Sam?
Thanks, Judy. Dr. Bell, first of all, thank you so much again for being here with us tonight. We certainly appreciate that. We put this on our Facebook page last night, and we have been gathering some of your questions throughout the day today. And Dr. Bell, I'm sure you are still getting questions about the makeup of the vaccine, the nuts and bolts of what is in it, and the effects that it can have. So our first question comes from Laura Gainey, and we're going to pull this up full so you can see it there as well. She wants to talk about infertility and birth defects. She says, I have my appointment to receive the vaccine. However, I'm still on the fence, and I want to make sure that I make the best possible choice for myself. She says I can't find hardly any research on infertility. So can you talk about what research has come out specifically in regards to pregnant women and infertility specifically?
Well, and those are two different questions, because the infertility assumes that the woman is not pregnant. But for pregnant women, there's not abundant evidence for pregnant women, simply for the reason that pregnant women are rarely enrolled in clinical trials to study how drugs and vaccines will affect them during pregnancy. So for pregnant women, we don't have any evidence that they will suffer adverse events from the vaccine. This is not a live virus or a vaccine that has a weakened virus in it, which can be recommended against for pregnant women. But we do look at the fact that pregnant women are known to be more likely to have complications during pregnancy. So we recommend that pregnant women consult with their healthcare provider to weigh the potential benefits of the vaccine in preventing complications during pregnancy against any potential risks. And as far as infertility, I'm not aware of any evidence. We have not yet had a sufficient body of evidence to suggest that this vaccine would affect infertility, and in fact, would affect fertility. And in fact, I'm not aware of any vaccine that has an effect on fertility.
Well, thank you for that. And by the way, for anyone who is looking at home, we do have a story about this up on our VaxFacts page on WISTV.com. Again, we want to get to one more question, Dr. Bell, before we have to hit a quick break. This one comes to us from Elizabeth Adams. She asks, why won't DHEC allow school nurses to administer the COVID vaccine to school staff when it becomes available for them?
Well, DHEC is not preventing school nurses from administering the vaccine. Nurses are required, because they must practice under an approved order or a physician's order to administer a vaccine. So if the schools are in a position to have a physician's order for the nurses to administer a vaccine, DHEC is not in any way preventing that. I think that's something that's being explored. And so we are working to engage as many vaccinators as possible, those who are trained and skilled in providing vaccinations. That's to our benefit. And so we'll look at all nurses and other licensed professionals who can administer the vaccine to help us improve access.
All right, Dr. Bell, still so many moving parts. We certainly appreciate that. To all of you at home who are submitting questions, thank you. Keep posing them to us. We're going to try and get as many of them in as we can during this hour. Obviously, a lot to get to. We're going to take a quick break. Check out the Facebook page. Make sure you post your questions, and we'll be right back.
Who said that?
Alicia.
Oh.
Hello? Can you hear me?
Sure, yes.
You're going to do great.
Roger, can you hear me? This is Alicia Barnes.
Hey, Alicia, absolutely.
Hey,
I can
how
hear
are
you
you?
clear.
Yes, I can hear you very clearly.
Am I too loud or too low, or is that good?
Nope, you sound crystal clear. I'm not
All
seeing
right.
you, but I saw you before we started, so I'm sure that the picture will come up. So no, this is perfect.
Okay.
Can you hear me okay?
Yep, absolutely.
Okay, there you go. I'll see you in a few.
All right, sounds good.
Great.
Oh, welcome back. As vaccine access expands, South Carolina hospitals have been slammed with phone calls. So many people right now trying to schedule their COVID-19 vaccine shots. Here's the problem. You cannot call to register. You must register online if you want to get vaccinated at Lexington Medical Center. So if you are eligible to get vaccinated, you have to go to the website lexmed.com/vaccine. Now, once you're on the website, click on the vaccination registration request form and then hit submit. About a week later, once all the information is verified that you are eligible, you'll then receive an email from the CDC. Now, this is very important because this email is not going to come from LMC. It's going to come again from the CDC. Open it up, read it, follow the registration process, and then when you receive your sign-up email from the CDC, register and schedule your appointment as soon as possible. Now, after you receive the vaccine, you still need to practice social distancing. So you still need to wear your mask and you need to continue to wash your hands. So now that you know the whole entire process as to how you sign up to register for vaccination at Lexington Medical Center, I want to be able to now bring in Roger Sipe, who is the VP of Operations at Lexington Medical Center. Roger, thank you so much for being here with us tonight. Lots of questions to be able to get to. I first want to talk about registering, the email process. I'm hearing from so many people who say, you know what, my dad's 84, he doesn't have an email, he doesn't have a computer. So my first question to you is, do you have to have an email? And also, can you share emails with other eligible family members to be able to register?
Great questions. And first off, thank you so much for having me here this evening, Alicia. And yes, right now the VAM system does require that you have an email to be able to get an invitation sent to you. It is something that they're currently working on, and we've been in contact with them. And we think within a week or so, hopefully they're going to have a resolution to that issue. So what we're doing in the interim, when we get calls and there's someone who's 70 years old or greater, or maybe even younger, that doesn't have an email account or even access to the internet, we're asking them to look to a trusted relative, church friend, someone that they know and trust, and see if they can assist them in opening up a Gmail or Yahoo account such that they can set it up and get their invitation sent to them. But it is a requirement today.
Roger, thank you so much for that. And also, just to clarify there, what kind of personal information are you giving out in this registration form? Because if I am older, if I'm 84 or 85 and I'm relying on one of my family friends, would I be giving out my social security number, or what kind of information so people can know, you know what, hey, I might need to flag this?
Yeah, that's a great question. And Social Security is not required. It's actually 4 pieces of information. It's the name, their date of birth, their email address, and then what category makes them eligible for the 1A, which we're administering to currently.
Okay, and then what right now are the largest barriers to the vaccination process at the Lexington Medical Center?
Yeah, that's a great question too. So you alluded to and mentioned previously some of the changes this week with the expansion of the 1A category that now includes the individuals that are 70-year-old and greater, and then also the expiration date of January 15th that was set by our governor of everybody in the 1A category to go ahead and schedule their appointment by the 15th. That combined with DHEC also made some improvements to their website where you can actually go to their website, bring up a map in the Midlands area, and click on different vaccine administrative locations, and it takes you directly to their website. And then finally, we made an improvement on our website and created a vaccine request form to really automate that process. And I think all three of those things combined, overnight, we had about 10,000 requests for vaccines. So that sheer volume and trying to work through that volume, that's one of the challenges. Second challenge would probably be the VAM system itself. It's a good technology and the best thing that we really have available to us right now. But there's some functionality that we're trying to work through there. The email requirement also being one. And then we've had some elderly people that aren't as technology savvy that have talked about just navigation through some of the screens. So we've got people available either via phone or in the clinic that are assisting them with that.
Let's touch on that.
And then
real
something
quick.
that's not a barrier today, but potentially in the future could be, as everybody's talked about, the increase in our COVID and overall census in the hospital. And then at the same time, opening our vaccination clinic, we've got competing resources for the same staff. And our staff, I'm in awe of them every day as I see what they do in caring for these patients. But we feel like we're going to get to a point where those may become competing resources.
Let's talk about the tech matters real quick, because I'm getting a lot of inbox messages about this. Once somebody receives their invitation for vaccination and they schedule their appointment online, does it matter what browser they use?
That's a great question also. It absolutely does. The VAM system is not compatible with Internet Explorer, so you've got to use as your browser Google Chrome, Microsoft Edge, Firefox, or Safari. So the questions that we have had where people have had an inability to access the invitation, get into the hyperlink, and register predominantly have been browser issues. So do not use Internet Explorer.
All right, well, we appreciate that. We appreciate Roger Sipe there for his time, and we'll be right back after this break.
Can you hear me now? Okay, I was asking, I was asking the lawmaker stuff that we didn't get to in the first half hour about the criticism of DHEC. Is it possible to drag that over? I would like to ask that first. Okay, just let me know when it's ready. Okay, thank you.
From WIS News 10 in Columbia, a special report. The COVID-19 vaccine in South Carolina.
WIS COVID-19 special report. I'm Judy Gatson, Sam Blyweiss, and Alicia Barnes joining me in just a bit as we work to answer your questions and concerns about COVID-19 and particularly the vaccine rollout here in South Carolina. Continuing our live interview this evening with Dr. Linda Bell, state epidemiologist here for South Carolina from DHEC. Dr. Bell, thank you once again for your time this evening. A lot of questions coming in on our Facebook Live, a lot of viewers trying to make sense of what to expect right from here on out. We are getting questions about, I guess, what's best described as uneven distribution of the vaccine. Some people saying that, you know, some hospitals have some supplies, other hospitals saying we don't have any at all. Can you give us any insight about what to expect about vaccine supplies in different communities around the state as people try to figure out the best place to try to schedule their appointment?
Of course. And let me say first, why we had to place the vaccines where we've placed them so far. First of all, there is the limited supply. But the first vaccine that we received that was available to be administered for those phase 1A individuals is the Pfizer vaccine that has to be stored at the minus 70 degrees. It has to be in an ultra cold freezer. And there are a few facilities that had those ultra cold freezers. And the other thing is that the minimum order for the vaccine is 975 doses. So basically almost 1,000 doses. A provider has to be able to handle 1,000 doses of that vaccine and hold it at minus 70 degrees. Well, when the initial federal plans were laid out, states understood that phase 1A would be individuals who are prioritized or hospital workers, or workers in healthcare facilities, and first responders providing emergent medical care in the field. After we had already submitted our federal plan and designated the locations that had the capability to manage that number of doses at those ultra cold temperatures, the Advisory Committee on Immunization Practices that advises the CDC changed the number of individuals included in phase 1A to essentially move that from about 185,000 people to roughly 350,000 people. So very briefly, we had to rapidly make decisions to figure out how to get this very sensitive vaccine out to these other sites. And so we were quickly working with providers who have to demonstrate that they're able to hold that number of doses at those ultra cold temperatures, or that they can receive a redistribution from DHEC. We now have the Moderna vaccine that's not as temperature sensitive and doesn't require managing those nearly 1,000 doses. It's more like 100 doses. So currently we're strategically working with onboarding more and more providers who are able to manage the vaccine inventory without any risk of wasting it, and who are also staffed up to be able to administer a large number of doses in a short period of time. I was unable to hear the other speaker, but I do want to say, because I think there were some questions about VAMs, and providers have to be able to onboard with the computer system to enter the inventory that they're receiving and track that. And for that reason, that limits the number of providers across the state who are ready to meet those requirements. But again, we're quickly activating new providers each and every week, and we're making sure that we get adequate coverage in rural areas, that we're working with a range of providers that I think I've already mentioned, the independent pharmacy chains, retail pharmacy chains,
right,
community health centers, and so forth.
And Dr. Bell, I'm glad that you mentioned the concern about VAMs and the training that's required, right? And that system tracks the vaccine management and even reminds people about when they're ready for that second dose. It does provide the perfect segue to the next question, which really addresses some concerns that lawmakers have raised. Representative Neil Collins actually posted on Twitter just yesterday saying, quote, DHEC had 5 to 6 months to implement a distribution plan on day one of the public rollout. Thousands of waited hours and still no appointments. He goes on to say, we should have a statewide app that puts everybody in a virtual line and updates your status in real time. So let's take these one at a time. First, just looking at the central issues of training and of ramping up of what we're doing for the vaccine. In your estimation, is there anything DHEC could have done to be more proactive?
Well, the federal government asked all states to submit a plan for receiving the vaccine, and we submitted our plan, and that was approved. The plan that we submitted was responsive to what the federal requirements were at that time, and the federal government also required us to submit a plan for pre-positioning the doses so that they would be ready to administer. And that was prior to the emergency use authorization for those vaccinations that gave the specific indications. And it was prior to the Advisory Committee on Immunization Practices vote that expanded the number of individuals who were eligible to receive the vaccine. So we were essentially locked into a plan, making arrangements with those facilities that had those strict temperature requirements and the ability to receive those roughly the 1,000 doses. And that was in the initial plan that we submitted months before we received doses. And then shortly before the doses arrived, they made that change. And so we had to work with providers. This is a new computer system that does require training and onboarding. And many providers didn't have the, as I said, that temperature requirement. So this is not like a product that there's an existing mass distribution site that you can put the product on the shelf and just plug it into some retail setting. It can't sit on a shelf. It requires skilled and trained providers to administer it. And so there are many, many logistics and restrictions on the use of the product. So it's not the same as moving a drug or another vaccine simply into a retail setting. There were many restrictions. But I do know that we are updating our plan. We've updated the original plan that we submitted, and we continue to work on a weekly basis with our partners, healthcare facilities, the Hospital Association, to ramp up and to address this rapidly moving target that is evolving every single day.
It is evolving every day. Looking forward, I know one of the frustrations has been with the email address because every person has to have their unique individual email address to register. So as we look forward about streamlining this process and making it more efficient, just give me first of all, will the email process always be a protocol for this vaccine? Do you anticipate some sort of app or something to streamline it and make it more efficient? Is there any support DHEC needs to be able to really respond to this in a way that gets people vaccinated more quickly?
Yes, we're exploring a number of options, and that requirement for an email address, I do want to make sure that it's clear that for individuals who don't have an email address or who don't have internet access, they can call the DHEC care line and get assistance with being pointed to a facility that is making appointments. So the DHEC care line, even though we've had many, many thousands of calls, we're working on that assistance for people who don't have that internet access or don't have an email address so that they can call a location and make an appointment.
Well, excuse me for to interrupt it, but that was a question that we got earlier today, so I want to be crystal clear about that because I want people to understand the DHEC care line cannot schedule an appointment, but it can put you in touch with a provider in your area. But when you contact that provider, you still need an email address and the internet access to actually register, right?
Yes, so that was just for the first step, and thank you for that clarification. DHEC can't make the appointment. But yes, we're looking at other options where there will be a system that can link people directly to an appointment so they don't have to go through the VAM system. That's the federal system that was provided at this time. It's not perfect, but we are exploring other options.
So, Dr. Bell, I heard some encouraging news in a conference call with Prisma Health in the upstate earlier this week. They are obviously overwhelmed. I mean, Greenville County or Greenville is the highest infection rate of any mid-sized city in the nation right now. So their hospitals are really at a crisis point. But they have been able to ramp up 3 mobile vans that are going to go out in the community to do vaccinations because the hospital just can't manage that right now. What is the timetable for us to see other mobile vans in our state, for us to possibly see the drive-through clinics like what we're seeing in North Carolina, Georgia, and Florida?
So I can't answer, Judy, those community level setups, because there are facilities that may contract with turnkey vendors who have everything that they need with the staffing, the storage, and the mobile units to deliver those services. Different healthcare systems can make these arrangements. So that timetable for what one community may receive as compared to another could vary widely.
All right, we have some viewer questions for you. People asking about allergies, and Paulette says that she is allergic to shellfish and that she heard it's safer for her to get the Moderna vaccine as opposed to the Pfizer vaccine. Can you tell us if that's true, Dr. Bell?
Well, anybody that has a history of a severe allergic reaction to a vaccination should not receive these vaccinations. Now, if they have a history of a severe allergic reaction to something else, I recommend that they consult with their allergist about receiving these vaccines, because those allergists will be familiar with the components of the vaccine and their allergy histories to make individual recommendations. So the safety profile of both of these vaccines is very similar. The contraindications for those with severe allergic reactions are similar. But anybody that has a severe allergic reaction history should consult with their individual healthcare provider.
Dr. Bell, we also have a question from another viewer. This is Sarah Kelly over in Lexington, saying that she has an underlying health condition, severe hearing loss, and she's wondering when the COVID vaccine will be available and how people who are dealing with certain disabilities what options they have for being able to sign up for an appointment.
So depending on their age group, individuals who also are, I'm sure everyone knows that anyone 70 above, regardless of underlying conditions, is now eligible to receive the vaccine. For people who have other comorbidities that are, or other underlying health conditions that are known to increase the risk of having severe complications, those conditions are things like heart disease, underlying lung disease, diabetes, obesity. And those individuals are currently in phase 1C who have underlying conditions. So I've already said that how quickly we will get to those additional phases. There are many factors that are unknown to us at this time, the vaccine supply being the main one. But how quickly we ramp up with these other providers that we've spoken to, other means to reach the population. And so I don't have a timeline for when we will move into those subsequent phases.
All right, Dr. Bell, I'm going to get on our Facebook Live to answer as many questions as I can. Sam has been talking with some of our viewers and has some questions from them now.
That Facebook page. And also just a quick reminder to everyone who's watching at home, if you go to the WISTV.com homepage, you can go to the VaxFacts page and you can submit a question to us there as well, along with the Facebook page. But want to go ahead and get to this question from Angela McCowan. She says she wants to know, is it safe to receive vaccine with COVID-19 antibodies in your system due to testing positive for COVID-19. She goes on to say, I know that with a flu shot, they recommend you not take it while having flu-like symptoms. What would your recommendation be, Dr. Bell, for that person?
The COVID-19 vaccines can be administered to people who have recovered from COVID. So it's a similar recommendation that their symptoms have resolved. If someone has received treatment for COVID, that monoclonal antibody treatment, then there's a period of time that they should wait to receive that, to receive a COVID vaccine. Another reason that we ask people who have recently been ill to wait is because there's actually a presumed period of immunity of at least 90 days. Reinfections have not been reported within the 90-day period. So that while the vaccine supply is very short, we're asking people to wait who have recently been ill to be vaccinated for those who do not have presumed immunity. Because for those who have recently been ill, we believe that they're unlikely to be reinfected for at least that 90 days.
We have another question here from Joseph Konopka. He's asking specifically about the type of vaccine. He asks, can a person choose which vaccine they want to take? Obviously, we know there are a couple of different ones out there right now with emergency use authorization.
No, people won't be able to choose. When they schedule an appointment, they will receive the vaccine that is available at that site. But I will say that the profiles of both of these vaccines, the safety profile and the efficacy profile, are very similar. So attempting to make a choice between one or the other with the assumption that one is superior is not the case. So any effort to make a choice from one over the other is not recommended.
All right, Dr. Bell, thank you so much for answering some of our viewer questions here on Facebook. Again, we are monitoring it live, so get on that Facebook Live. We're streaming this on there right now. Submit your questions. We're working to answer as many as we can. And again, that VaxFacts page, that Vax FAQ page right here on our homepage, that's another spot that you can actually click right here. If you submit the question, you get this submission form here. You can send us your question there, and we'll get back to you with as much information as we possibly can. Much more to come here on our vaccine special coming up after this break.
Welcome back to our WIS News 10 COVID-19 special. Our healthcare professionals on the front lines are dealing with staggering new cases and record hospitalizations. Our Emily Wakeman joins us tonight with an update on how our hospitals are doing around the state. Emily, what did you learn today?
Yeah, Judy. Well, nurses tell me it's been a really tough, overwhelming few weeks. The nurses here at Newberry Hospital tell me that all of their COVID-19 patient beds are full right now. And this is the situation at so many hospitals across the state right now, with the South Carolina Hospital Association telling me that 19 hospitals are looking at over 90% capacity right now. And both the nurses and doctors tell me that as they're expected to care for more and more patients, this is having both a mental and an emotional and physical toll on the entire staff.
We're tired, we're exhausted. It's mentally and physically exhausting caring for these patients. We're their family while they're here.
It's disheartening just because you receive the patient, they're scared. You know, they don't know what's going on and they can't have their family at the bedside, unfortunately. So we're their resource, we're there for them. Sometimes, honestly, I have to keep myself from crying.
You leave here just completely exhausted, and it's really hard to shut your mind down.
I will say that a couple of staff members saw a very young patient yesterday, and after realizing that this patient might not make it, everybody kind of broke down a little bit and started crying. It's something that brings you to tears.
We've not seen the end of it, and I'm not sure when the end will be.
So, Emily, you had a chance to talk with them about what their day-to-day life is. I mean, for obvious reasons, our cameras aren't often allowed inside of the hospital, but how are they holding up?
Yeah, Judy. Well, as you just heard from many of them, they're tired, they're exhausted, they're overwhelmed. They say that the biggest issue right now continues to be staffing, and that as a lot of these hospitals limit visitation, here at Newberry Hospital, they limited visitation this week. I know that Lexington Medical Center also has limited visitation. This is the situation at a lot of these hospitals right now. So these doctors and nurses become the family members of these COVID-19 patients that aren't able to see their family members. And as I'm sure you can imagine, this just continues day after day to take that emotional toll on all of them as they're also trying to care for these patients' physical well-being. Judy?
Well, a heroic job that they are doing, and we can all show our thanks to them by doing all that we can to follow the protocols, including wearing a mask when we're out and around others. Emily, thank you so much, and our thanks to them as well. Well, joining us now again is DHEC, our state epidemiologist, Dr. Linda Bell. Dr. Bell, we are wrapping up, coming to the conclusion of our time, but I just wanted to follow up with you about, just what your admonition is to everybody in our state right now. I mean, this is a situation where, what one does affects everybody else, right? And we see the impact in other areas of our state, and we just wonder what the weeks and months are going to be like ahead if we don't all start complying and following these guidelines.
Yes, Judy, that was a really heart-wrenching report from some of our frontline healthcare workers, those in the hospitals, those who are at risk in community settings, who are seeing people who walk off the street with illnesses and may be potentially exposed. And the fact that our bed capacity is declining. In other words, the number of beds that are occupied is increasing. And the sheer fact that there is something that each and every one of us can do to change that. I really wish I could figure out a different way to say that this is real, that it's been affecting us for months and months on end, that unfortunately we are in a phase now where it looks like things are getting worse. And coming off of the holiday season, there's a delay in people experiencing illnesses, and then some moving on to more serious illness and requiring hospitalization. So we're not near the end, but there are some things that we can do to change this. We are encouraged about the number of people who want to be vaccinated because it will bring protection to a large number of people. But to get to that goal of an estimated 70% of the population before we can start changing these things, it's going to take us months to get there. And so realistic expectations for the vaccines, we do want people to recognize that. Please try and make those appointments. Please accept the vaccine. It's safe, it's effective. In the meantime, let's take care of each other, of our healthcare workers, and use the masks, use the measures that we have at our disposal to protect ourselves, to protect everyone. And in the meantime, that's what we have, and that's what works. And we've seen it work in other communities and other countries, and we can get there, but we need to do something dramatically different immediately to change the course of what is affecting South Carolina right now.
And Dr. Bell, I would be remiss if I didn't ask you about our schools and the situations we are dealing with there. There's really not an argument that, families need the option of in-person learning. I mean, families need to work. I mean, our healthcare workers, have a job to do. So we need to figure out a way. The question is how to do it safely. Right now, what can our schools do? I mean, they say they can't guarantee social distancing. They're asking for masking. They're trying to enforce it the best way they can. But is there anything else we can do in our schools to make it safer to try and contain the spread, especially in light of our rising numbers?
Well, the thing that we can do to make our schools safer is to make our communities, our surrounding communities safer, because we don't really see ongoing spread in the schools. We do see cases that are reported, and we see higher rates of cases in high schools. A lot of that is attributed to extracurricular activities. So many of these cases are acquired in the community. What we can do to make the schools safer is to make the surrounding community safer. We've got to bring down the disease rates. The schools are doing much of what they can. They're doing much of what they can for the physical distancing, the masks, all those measures, but it is these exposures in the surrounding communities, in the businesses and community groups, gatherings, that they can enforce the use of masks in schools, but if we can't enforce that in the surrounding communities, those people associated with schools will become cases.
All right, Dr. Linda Bell, state epidemiologist from DHEC. Dr. Bell, thank you again for your time, for the hard work of your team and everyone at DHEC for addressing this public health crisis in South Carolina. We will get through it together, but we've got a lot of work to do to get to the other side. Thank you again, Dr. Bell.
Thank you for the opportunity.
Absolutely. Sam and Alicia, our thanks to you as well. I mean, this is really just the tip of the iceberg, ladies. Sam, we look to cover a lot of these issues still in the weeks ahead.
Yeah, Judy, you know, COVID-19 really hits home when you lose a family member, when you lose a friend, and it becomes very real. But as Dr. Bell just said, we have to use the measures that we have to save lives.
Right.
Yeah, your actions affect everyone around you. And Judy, I think we got some good information from Dr. Bell. Again, go to that VaxFacts page and submit your question.
And we want to close out by saluting our healthcare heroes. Thank you for joining us, everyone. Good night.